For more than 31 years, Linda Muller has been at the heart of the community health center movement. From small beginnings in the basement of St. Luke's Hospital in the city of Newburgh to 24 care sites, serving 4 counties and over 50,000 people. Linda has grown Cornerstone Family Healthcare into the organization that it is today. What's the result of 3 decades of trailblazing leadership, a more equitable health system, countless lives impacted, and a strong organization of over 600 employees? All built on the principles of caring, dignity, and respect, united by one mission.
How do you measure the legacy of a giant?
Linda Muller into one word.
She's a trailblazer.
Heart, mission-driven.
I think of inspiration. I think of grace. And I think of directness.
Such passion, extremely passionate.
Relentless.
When you have the full resource of Linda Muller, you really don't need much more.
Everyone has an initial impression of Linda. It's high energy, high motivation, all heart.
I remember her coming into her first board meeting. She was so firm. She was so positive.
She was able to get people to do things that people really didn't want to do, but they did.
I remember seeing Linda for the first time, and she spoke so passionately and confidently about this vision that we now have here as Cornerstone, about being an elite place of care, the #1 place for people to get health care for everyone. So confident, and 15 years later, we're exactly that place.
I remember days when Linda was trying to grow the organization. People, oh, you can't go there, you can't do this. She would always say, watch me.
She's a great inspiration for how to get jobs done.
When something's important to her, because it's important to her health center.
Not everyone liked her. She was there because she got it done.
Linda keeps pushing. There were some tough times in the beginning.
I always think of the phrase, you are not a good leader until you are a leader who makes a leader.
You cannot lead by demanding respect, by forcing people to do things. You're more of a leader by being behind them and pushing them forward and empowering people.
And Linda gives that to her team. She trusts each and every one of us to get the job done and acts more as a mentor and a guide.
She doesn't tell me what to do. She asks me probing questions. At the end of the day, it's me that's making the full decision, but she's able to pull that information out of me.
She did a really good job of making you feel part of the team and that you matter.
She praises her employees. She praises her board.
If there's issues going on with certain employees, she takes it so to heart, which not all leaders do.
She cares about the employees, which then allows us to be able to be free to care about patients.
In some of the darkest times, personally for me, she was either the first person to reach out or the first person that I wanted to reach out to.
When I first started, I had breast cancer. I developed breast cancer, and I had to step away a little bit from the board. But she was very comforting to me.
Linda's leadership has helped me really just understand how you can be a compassionate leader and also be a very strong leader.
You get more done with the ability to create relationships that are long-lasting.
Probably the last person that found his job looking at a New York Times wanted ad. I got here and I loved everything about the mission and the work we did, and I blinked my eyes and I'm here for 15 years.
The leadership that Linda provided about just being open, then I did to all the staff. So really that trickle-down effect.
But we trusted each other. I think that's another key word, trust. Because if you can't trust a colleague, then you don't have anything.
Whatever she might have been asking for or pushing for was never about her, but rather about her health center, her patients, and I thought, gee, this is the kind of mission that I want to be a part of.
In a little less than 12 years, the growth has been tremendous. Linda has overseen that growth, but her leadership style hasn't changed. It is who she is.
I've always watched Linda connect with everyone she talks to, and I've watched those in our community have the same mutual respect for Linda.
Working for Cornerstone is like working for an extended family.
It's not about her. It's not about the buildings. It's about the it. The it is the mission.
It's the reason why we do our job.
Linda's done a phenomenal job of implanting that in every single one of us.
Healthcare is a right.
And not a privilege.
Doing the right thing.
At the right time.
For the right reason.
Blessed are the flexible.
As they shall not be bent out of shape.
Leave it better than you found it.
Her mother once told her, if the refrigerator door is open, don't ask who opened it, don't try to figure it out, just close it yourself.
Promises made and promises kept.
She's got 2 buttons on her desk that she loves to punch every now and then. You know, she'll do a no, you know, or a yes.
That's another one. You know, when she wants you, she's calling your name loud and clear.
The all-staff meeting started with the song Happy. And the CEO came into the all-staff meeting and she was snapping her fingers. And I was like, this is really cool.
All of a sudden, a song will come to mind and she'll belt out a tune right out of her office.
I've also seen her dance on the dance floor, you know, and she's got great moves.
She could dance, she could sing. Yeah, she's very talented. She could cook.
Linda loves to cook. That's another thing that comes out from her generosity.
And she's an incredible mother, grandmother, wife.
You can tell it's family. Family is so key to her.
And you will be missed.
Thank you. Thank you for all that you have done.
Your day-to-day presence will be a loss.
I'm gonna miss it so much. I really am. So yeah, I mean, it's been a lot more than just a working relationship, colleague to colleague. It's really become a friendship as well.
I just hope that she has a wonderful retirement.
You do you, Linda, because you are an amazing inspiration to so many.
I appreciate you bringing me on board as a board member. I can't tell you how much I appreciate your friendship, how much I've learned from you. I love you.
Made a change in the lives of thousands of people. And that's one of the reasons that I love you.
And that's Linda's legacy, right? She's leaving behind competent, capable leaders who today know how to carry on the mission of the health center because she taught us it.